Dear students, the topics of our next lecture is the root canal obturation. So, first of all, dear students, good morning. Let us start the online course of endodontics. First of all, please let me say my words of supporting of you in this some complicated situation, but I hope that everything will be perfect as soon as it possible. So, the topics of our lecture today is disinfectants and intracanal medicaments in endodontics, as well as temporary reconstructions of the crowns. So, first of all, let's repeat the main aims of endodontic treatment. As you know, the main aim is careful mechanical chemical treatment of all of the root canal system. You know that root canal system is really complex and contains of main root canal as well as different lateral canals, ramifications, and so on. And first of all, we should to provide the mechanical chemical treatment of this complex root canal system as if it's possible. The next aim, this is the removal of dental pulp and residues of dental pulp, as well as all of the microorganisms. And finally, we should to provide the simplification of root canal system using the shaping of root canal with different methods, with different instruments. And finally, the main aim of endodontic treatment, this is a providing of perfect 3D hermetic obturation of the root canal. So, if we look at this really beautiful picture, we can see that root canal system is really complex. And according to Barrett, that wrote in the year 1925, that one of the most complex of human system, this is a pulp cavity morphology. So we can see from this picture that this root canal system is really complex, and sometimes this is a challenge for the endodontist to provide perfect shaping and chemical disinfection of such complex anatomy system. Here we can see the 3D model of the real tooth. And as I said, besides the main root canal, also we can have some different ramifications, some delta complex in the apical part of the root canal. And also we can see that one root canal can have a different number of the foramen apicale. So, due to this really complex anatomy, it's really complicated to provide the mechanical shaping of all of this system of all of these structures. And according to the studies, using just mechanical shaping, we are able to shape, we are able to treat just the 70%, maximally 60 up to 70% of the root canal system. And so the second really important part of endodontic treatment, this is a careful and perfect disinfection and chemical irrigation of the root canal. So let's say some words about definition of irrigation. Generally, it means the washing out a body cavity or wound with some water or some medicated fluid. And also from this part we can find some objective of the irrigation. First of all, this is a mechanical aim when we provide the flushing, lubrication, decalcification, as well as dissolution of different pulp residues, necrotic tissues, removal of debris, smear layer, removal of the microorganisms, and also during this aim we can receive some bleaching effect. And the second main objective of the irrigation, this is a biological one. It means that also during the irrigation we will receive the antimicrobial effect due to the properties of the irrigation solution. So let's repeat some information about smear layer. As you know, this is an organic inorganic layer that is formed on the walls of root canal after or during the mechanical shaping. It also contains the necrotic tissues, some projections of odontoblasts, as well as microorganisms. Microscopically, we can differ two layers of smear layer. The inner one is lying on dentinal tubules on the depth of something like 40 micrometers and blocks the dentinal fluid movement. And the external one has thickness to up to 5 micrometers and is lying on dentinal tubules and intertubular dentin. And as you can see, it also contains microorganisms, so we should remove it and we should remove it using the different irrigation solutions, because smear layer also blocks the irrigants penetration into the dentinal tubules, and due to this, one of the requirement of effective irrigation solution, this is a dissolution of smear layer. In this case, as I said, we should use the effective disinfection solution, and its movement has a great meaning in the canal cleaning, so-called blessed cleaning of the root canal. So now you can see the list of some techniques of irrigation that are recently used in endodontics. All of them we can differ onto two large groups. The first of all, this is a manual techniques of irrigation, and the second one, this is a machine-assisted techniques. So let's discuss all of them in more details. So, with respect to manual techniques of root canal irrigation, these are the simplest one. Mostly they don't require to use some expensive devices, some complicable devices, and it could realized using, for example, the syringe, like we can see on the picture, that could have different size, at least 10 milliliter. This is maybe the most useful size of the syringe in endodontics with respect to irrigation. And also this syringe should be used with special needles or cannulas. These cannulas could have different design, but I'll say it in some minutes. With respect to advantages of this, the simplest method, this is a really easily controlled, this is a cheap, for this technique, they recommended to use a special size that is measured in so-called gauge size, and for endodontics is recommended to use 27 up to 31 gauge size cannula or special needles. But also there are some disadvantages, like in this case we have just insufficient flushing effect, and solution is delivered just 1 millimeter deeper than the needle is placed in the root canal. But on the other hand, this is the simplest one. So we can use, as I said, different sizes of syringes, mostly the 10 milliliter, sometimes 20 milliliter size syringe is used. It's recommended to use a so-called special lure lock design. That is more safety, because using this design there is some special lock in the top of this syringe, and there is a prevention of some extrusion of this solution through the cannula. As I said, we can use special needles, and it's recommended to use special endodontic cannulas for this aim. These needles could have different design and different modifications. They could have bending the tip, FlexiGlide needle, and also they can have different design of the tip, like we can see on the picture. They could be beveled, they could be monojacked, they could be safe-ended. It means that they have this part through this solution is delivered on the side of the needle, and all of this is made for the prevention of some random extrusion of the irrigant solution through the apex. So here we can see some special endodontic cannulas that could have different size ones. Once more, I repeat that for this classification, for their specification, special gauge sizes are used. And you can see that they also have the rubber stop that is able to measure the working length of root canal and to prevent this random extrusion through the apical part. So here we can see the requirements for the ideal needle for root canal irrigation. They should be blunt, should allow backflow, they should be flexible, longer in length, they should be easily available, and of course cost effective. Here we can see the different needle designs, so the shape and as well as the tip is really different, and the main principle and main aim is to prevent this extrusion of the solution through the apical part, and also another aim, this is a deliver of this solution as deep as it possible to the apical part of the root canal, but once more we should to prevent the random extrusion of the solution. The next manual technique that could be used for root canal irrigation, maybe for root canal irrigation, for activation of root canal irrigation, these are the special brushes. We could default two types of them. First of them, these are the so-called endo brushes or endodontic micro brushes, like we can see on the picture. And this is some really thin and small brush that contains the nylon bristles that are set in twisted wire. They cannot be used till a whole working length, and sometimes these bristles could be dislodged, and so this is like some main disadvantage. They are used in root canal, that we fill root canal using irrigation solution, then put this endodontic micro brush and provide some so-called manual agitation. And the second tip, this is a Navy tip FX. This is a special needle or cannula that is covered by bristles, like we can see here, and it's used with this syringe with irrigation solution, and provides the additional activation of this solution during the irrigation from syringe. Also, we can use the next manual techniques of root canal irrigation, like for example manual dynamic agitation using the gutta-percha cone in the movement up and down in short 2 up to 3 millimeter strokes. And in this case we will receive so-called effect of apical vapor lock. frequency is something like 100 strokes per 30 seconds, so it could also provide additional movement of this irrigation solution in root canal. And now we will discuss the more complicable method that require to use sometimes really complicable and sometimes really expensive device. This is a machine-assisted irrigation in endodontics. The simplest method is to use a so-called rotary brushes that are differ onto the rattle brush, like we can see on the picture, and canal brush. So they are used with special motor and provides like additional activation of this solution inside the root canal. Here, for example, we can see that are used with blue handpiece or special endomotor. And when we use these brushes, root canal is filled by irrigation solution, and this application of these brushes leads to the additional activation and movement of the liquid inside the root canal. The second type of this machine-assisted irrigation, this is continuous irrigation during the rotary instrumentation that is used, for example, in so-called system Quantec E. That is self-contained fluid delivery unit. Contains a pump console, 2 irrigation reservoirs and tubing, and provide the continuous irrigation during the preparation. Here we can see the photo of this system. The next type of machine-assisted irrigation that we can use, this is the sonic irrigation. This is a relatively widely used method of endodontic solution irrigation activation, and we can differ 3 main devices that are nowadays available. First of them, this is a so-called Rispisonic file that combines the battery-driven vibrations like 9,000 cycles per minute with manually operated irrigation, like we can see here on the picture, this device. The next one, this is a so-called Vibrange that seems like a syringe, but also it is able to use acoustic or to provide acoustic vibrations. It has ergonomic design, it's easy use and suitable for all of types of the needles. And the final one, this is the endo activator. It looks like a portable handpiece that contains different types of the different sizes of the tips according to the size and diameter of root canal, and when we turn on this handpiece, it provides 10,000 cycles of vibrations per minute. So when we use some of this activator, we will receive the active fluid movement in the root canal. The next type of machine-assisted irrigation that is also really useful and effective, this is a ultrasonic irrigation. The devices used the frequency between 25 up to 30 kilohertz, and according to types of this ultrasonic irrigation, we can differ 2 groups, active and passive one. Active ultrasonic activation provide the simultaneous combination of ultrasonic irrigation and instrumentation, and nowadays is almost not used. But the second group, passive ultrasonic irrigation, is widely used in endodontics. In this case, the energy is transmitted from an oscillating file or a smooth wire to the irrigant in root canal by ultrasonic that induces acoustic streaming and cavitation, active cavitation of irrigant. And irrigant application could be provided in some methods using the passive ultrasonic irrigation. We can use continuous ultrasonic irrigation. In this case, the needle is simultaneously activated by ultrasonic handpiece, while the irrigant is delivered to an irrigation delivering syringe. And the second one, this is an intermittent flush ultrasonic irrigation. And finally, we will receive some cavitation of irrigant and active movement of this irrigant. So here we can see on the video the use of different activation system. First of them, this is a endoactivator. Here we can see the root canal that is filled by irrigant, and into this root canal we put the tip of the endoactivator, and we can see this cavitation. So we can see that a lot of different bubbles are formed, and these bubbles are able to be delivered in some deeper places, in some more narrow places of the root canal, and so it leads to increase of the effectivity of irrigation. Here, for demonstration, we can see the application of some lubricant, and finally the active oxygen is formed, and for their demonstration. On this part of the video, we can see the next method. This is the simplest one, when we use thin hand instrument with usual normal tip of ultrasonic that is used for the scaling, and really small rotations applying contour root canal, we will provide the activation. And finally, we can see the special ultrasonic device. This is like separative one, not from this unit, and with this devices special tips are used. So here we can see that using this activation, there is a cavitation of irrigant, and due to this it is able to be delivered into some ramifications, some lateral accessory root canals where we are not able to provide the perfect mechanical shaping. The next methods of machine-assisted irrigation of root canal, these are the pressure alternation devices like Endovac and rinse end system. For example, Endovac system contains from three main parts. First of all, this is a macrocannula. Then we have microcannula and master delivery tip. And the main advantage of this system that in this case we have less apical extrusion risk because we will create using this system so-called apical negative pressure, and this apical negative pressure is able or allows to the liquid to form so-called circulation, and so this liquid will go back onto the root canal, not will be extruded. Here we can see the picture of positive apical pressure that is created when we use normal cannula, normal syringe. In this case there is just one possible direction of liquid movement, and this is an extrusion through the apical when, for example, we will put some large power. So this is the main advantage of this system, the creation of apical negative pressure that leads to a smaller apical extrusion risk of the solution. This system is really effective and could lead to some to success of the irrigation without this some unpleasant situation of the apical extrusion. The next system, this is a rinse ender. It's placed instead the turbine handpiece without water cooling on our dental unit. And this is some syringe in special handpiece that provides the irrigation of irrigant that is oscillating at a frequency of 1.6 Hz, and it's transported to the root canal via cannula. The phase of this frequency is 100 times per minute. And in this case, unfortunately, we have some higher risk of apical extrusion, but also it provides some activation of this solution. Also, we can use continual irrigation during the shaping that is present in the case of so-called self-adjusting file. So here we can see the self-adjusting file that provides mostly like vibrations during the shaping, and because it also contains some part for the irrigation deliverment, it's possible in this case to provide the continual irrigation during the shaping of root canal. In this case, there is the prevention of some debris, of creation of a lot of debris in one place of root canal. And finally, we will discuss the recent advances in irrigation systems. So, for this aim, we can use, for example, light activation irrigation or laser activation irrigation, where we can use different types of the lasers with a specific length, wavelengths of the light. And the main advantages of these laser activation systems that they provide the antibacterial effect, and some of them are able to eliminate the Enterococcus faecalis that is maybe the most frequent and microorganism that is present in root canal, and especially it in the most cases lead or it could lead to the failure of the endodontic treatment, because this bacteria is really resistant and is able to be resisted even using some currently available antibacterial remedies in endodontics. And other lasers, like for example carbon dioxide, is able to remove and melt the smear layer. So there are two main effects. This is the antibacterial one, and this is the removal of smear layer. But also these devices have some disadvantage, and this is their high price, so they're expensive. The next method that could be used for endodontic solution irrigation, this is a so-called photon-induced photon-initiated photoacoustic streaming, or we can use the abbreviation PIPS. That leads to the strong agitation of solution inside the root canal, because in this case a special light is placed. We should to use a special device with this special photoacoustic and photomechanical properties. And this phenomenon generates a faster streaming confluence distant from the source in magnitudes threefold greater in comparison with passive ultrasonic irrigation, so is more effective. But also unfortunately, this is an expensive but effective one. Also, we can use light-activated disinfection or photo-activated disinfection, and in this case, we use special device that provides the creation of some special light, and due to this, it's able to provide so-called photodynamic antimicrobial, so-called chemotherapy in endodontics. In this case, the root canal will be filled by special photosensitizer. For example, toluidine blue or methylene blue could be used. And then this photosensitizer is illuminated with a light source that could be laser, white light, red light, light emitting diode, and also leads to the great activation. Once more, the same disadvantage, high price of these devices. And on this picture we can see the principle of this light-activated disinfection, that where special light will lead to this activation of the solution, and also provide the removal and elimination of bacteria, of viruses, fungus, and protozoa in the root canal. Besides endodontics, it's also possible to use it, for example, for the disinfection in periodontology, for example, in the case of gingivitis, or for example, in the treatment of caries lesion. And finally, two more methods that also could be used in for irrigation and endodontics. First of them, this is the electrochemically activated water that is produced with a unique anode cathode system, biocompatible, and according to some investigations, the internal walls will be much clearer after this electrochemically activated water use than in comparison with the most useful solution that is sodium hypochlorite is. But unfortunately, this method is not so widely used in praxis. Like, for example, the next one, that is oxidative potential water, that is electrolyzed saline in special machine that is called Aquacida. Also, there are no some more information about wide use in praxis. Maybe these two methods, these are something like experimental one, but they will, or they shows some good results in different investigation. So now we will discuss the different irrigation solutions that are used in endodontics to provide this chemical disinfection and irrigation. First of all, we should describe the properties or requirements for ideal disinfectant in endodontics. First of all, they should have prolonged and sustained antibacterial property. They should provide the germicide and fungicide property. They should remove the debris and smear layer. They should to dissolve the dental pulp residues. They should to provide the complete removal of smear layer. They should have low surface tension. They should be active in the presence of different liquids of human body, like blood, serum, protein derivatives of the tissues. They should be stable. They should provide the so-called decalcification effect, also lubrication effect. They should be biocompatible. It means that they should be non-irritating, non-allergic, non-toxic, non-antigenic, non-carcinogenic. They shouldn't have adverse effect on the physical properties of exposed dentin, as well as on the sealing ability of filling materials. They shouldn't stain the tooth structure. They should be easy to use and to apply into the root canal. They should be cheap, and these are the main properties or requirements of these ideal disinfectants. Unfortunately, none of the disinfectant that is currently available has all of these requirements. And so in this region there are still some more investigations because our aim is to find some really effective irrigation solution that could have all of these properties, but unfortunately none of currently available disinfectant remedies that is used in endodontics has all of these properties. But let me say, or let me introduce the most useful and the most effective currently available disinfectants of root canal. So here we can see the list of these solutions that are able to be used like disinfectant or irrigant in endodontics. So first of them, this is a sodium hypochlorite. Also we can use chlorhexidine, sterile water, saline. And you can see that sodium hypochlorite from this list, this is on the first place because this is a mostly widely used due to really high antimicrobial properties. So this sodium hypochlorite solution has a really high pH, up to 12, up to 13, and due to this high pH, it provides the good antimicrobial effect. With respect to concentration that is used in endodontics, this is 1 up to 5.25%. Maybe the most useful is 1 or 2%. As I said, due to high pH, it provides the excellent antibacterial properties, also is able to dissolve the organic parts of the dental pulp, but is unable to provide the dissolution of inorganic part. So it has low lubricant effect because it contains the chlor, it provides a high bleaching effect. That in the case when we put this solution on some clothes, color clothes, it could lead to the bleaching effect on the clothes also. Because it contains a chlor, it has the desodorization effect, and it's necessary to keep in mind to remember that this is a really aggressive solution because this is a toxic, it could lead to allergy, and if this solution is delivered on the periapical part or on the soft tissues, it leads to the necrosis of these soft tissues to the periapical tissues. So please be careful when you will use this solution. And normally it's necessary to use this solution with a rubber dam, because rubber dam provides, in the case of the correct application, it provides a good protection of the soft tissues before this aggressive solution. The next solution that could be used in endodontics, this is a solution of chlorhexidine digluconate in the concentration 0.1 up to 2%. It's effective for the gram-positive and gram-negative microorganisms. But please remember, if you will combine the use of sodium hypochlorite and chlorhexidine digluconate, be careful, because if these two solutions will be connected, they will be react, and some unpleasant situation could be present in this case. So we can see some experiment when we mix the sodium hypochlorite and chlorhexidine digluconate, and finally we will receive this substance with name parachloranilene that has this brown color, and this is a carcinogenic solution, carcinogenic substance. So if you want to use this chlorhexidine digluconate after you used the sodium hypochlorite, please know that before this you should to provide the irrigation using the saline, because you should to remove the remnants of sodium hypochlorite from the root canal, and just after this you will be able to use the chlorhexidine diglyconate. Be careful and remember about this, that these two solutions shouldn't be in contact together. Also, let me just say some words about possibility of use of sterile water and saline in endodontics. This is a really alternative solutions that could be used in the case of allergy to the another irrigants, but please remember that they don't have antibacterial properties. They just provide like mechanical flushing of the root canal, but for the chemical disinfection, this is insufficient. And as we said, the sodium hypochlorite is the most useful. This is really effective with respect to antibacterial properties, with respect to dissolution of organic part of smear layer and dental pulp, but unfortunately sodium hypochlorite is unable to dissolve the inorganic part of smear layer, and due to this it should be used in combination with some so-called chelator. One of them, this is a solution or gel of EDTA, ethylene diamine acetylene acid, and it is used in concentration 17 up to 18%. Because it is able to remove the inorganic part of smear layer. It leads to the opening of dentinal tubules, and also is used like lubricant. This EDTA is used in a so-called final irrigation protocol before definitive filling of the root canals, and this is a really effective combination when we use this EDTA after the sodium hypochlorite solution. Also, we can use a citric acid that has the similar properties of the like EDTA has, and this is also chelating agent that is good for dissolution or cleaning of calcium hydroxide residues, for example, and in endodontics is used in concentration 20%, but it is a little bit weaker than the EDTA. The next remedy that could be used in endodontics, this is a so-called Q-mix. This is a commercially available remedy, and it means the combination of two remedies in one bottle, like 70% EDTA and 2% of chlorhexidine. So is able to provide the complete removal of smear layer and disinfection. And according to manufacturer, it's able to eliminate almost all of the bacteria, including the Enterococcus fecalis that is really persistent in the root canal. It's recommended to put this solution for the 60 up to 90 seconds in the root canal. The next commercially available remedy is so-called MTAD. This is a mixture of tetracycline acid and detergent. It's also provide the bactericidal effect, including the Enterococcus fecalis, has the chelating properties but less than EDTA, separative one. It's biocompatible, but is not able to dissolve organic tissues of the in the root canal, and because it contains the tetracycline, it could lead to discoloration of hard dental tissues, because this is an antibiotic remedy that is able to provide the discoloration. The next method or the next substance that could be used like disinfectant in endodontic, this is ozone. Ozone, this is an active form of the oxygen, from the chemistry. This is a O3 molecule, and is able to eliminate also almost all of the microorganisms. It could be used in general medicine, it could be used for the sterilization in medicine, and also it's used in dentistry, not in endodontics, but also, for example, in cardiology, for the disinfection of the cavity, in periodontology, in surgery, and as I said, also in endodontics. The application of this ozone is realized using the special devices, like we can see on the picture. For example, we can use heel ozone or prozone, and this device generates the ozone from the air, and leads to the creation or to the change of this oxygen from air onto the active ozone. And application into the root canal is realized using the special rubber cup and special endodontic tip that is put into the root canal, and normal this time of application is something like 1 minute for one root canal. So this is also one possible method to provide a disinfection in endodontics. Could be used like additional method for the irrigation. And also, because as I said that unfortunately nowadays there is no ideal irrigation solution that could have all of the properties that are required for the ideal solution, there are still some investigations in this region. For example, we can see that some alternatives could or were introduced. Some authors recommend to use a bioactive glass for the disinfection in endodontics. Another one use the special nanoparticles that are able to have the electrostatic interaction with bacterial cells, and so they are able to eliminate them. Also, we can find some information about possibility of use of natural plant extracts, because some plant contains so-called polyphenols that are able to have the antimicrobial effect, or also some non-instrumentation techniques are also or were also introduced. But these are just alternatives, and further investigations are necessary for these alternative remedies. And let me say now the final irrigation protocol that is recommended of Czech Endodontic Society for final irrigation of the root canal before the definitive filling, definitive obturation. So if we have so-called vital extirpation of dental pulp, for example in the case of some pulpitis, we will use this protocol. So we will use sodium hypochlorite in concentration to 0.5%, minimally 30 minutes for one root canal. It means the total time of irrigation should be at least 30 minutes. Then we use the application of 70% of EDTA solution for 1 minute, and finally we should to remove this EDTA, and so we will use once more the sodium hypochlorite. If we had a strongly infected root canal system, for example in the case of pulp necrosis, of some periodontitis, apical periodontitis, we should to use the higher concentration. So high concentration of sodium hypochlorite provides also the proteolytic effect, and for these strongly infected root canals we should to use sodium hypochlorite in concentration 5%, minimally 10 milliliter for one root canal. Finally, we should to use also 70% solution of EDTA for 1 minute, and because we should to remove this EDTA, finally we will use sodium hypochlorite, but in the lower concentration to 0.5%, minimally 10 milliliters per one root canal. And after this we can provide the definitive filling. And also don't remember to use some of the activation method of this solution. You can use the simplest one, like manual agitation using good aperture cone, for example, or if you are able, you can use some machine assisted device, ultrasonic, sonic, endovac, and so on, because in this case you will improve the effective of the irrigation. Also you can use the warming of the solution up to 50 degrees of Celsius, because if we warm up the sodium hypochlorite, we also can increase their properties, antibacterial properties. But as I said, because we use really aggressive chemical substances, we should be really careful when we put them into the root canal, and we should pay our great attention to prevent some random extrusion of the solution into the periapical tissues, as well as application of this solution onto the soft tissues. First of all, of course, we should put the rubber dam, provide the correct application of rubber dam to be sure that we protect the soft tissues. But unfortunately, even we have rubber dam, sometimes we can extrude this solution through the foramen apicale, and in this case this is a really unpleasant complication of the irrigation, because in this case this really aggressive chemical solution will be delivered into the periapical region, and it leads to the necrosis of these tissues and to strong pain and edema of the patient. In this case, you should immediately stop the irrigation. You should use a sterile water or saline to decrease this concentration of sodium hypochlorite in the root canal. And in this region, you should dry the root canal by paper pins to remove the remnants of this sodium hypochlorite, and you should use the ice for this region. Sometimes the antibiotics are necessary to prevent the creation of secondary infection, and we can see this really unpleasant complication on these photos. So this is a really painful state of patient. It leads to the creation of some large edema, and fortunately this will be removed for some days when we provided the adequate therapy, like application of ice on this region, application of antibiotics, but please remember about this possible complication, and please prevent some extrusion. Also, due to this fact, we should always measure the working length of our endodontic needle or endodontic cannula to prevent this random extrusion. Be careful about this and remember about this. And the final part of our lecture, these are the intracanal medicaments. So generally is used in the case when we are not able to provide the definitive filling in the same visit, or if, for example, we have some really infected, highly infected root canal, and we should to be sure, and we should to provide the additional disinfection of the root canal system between the visits. So for this aim, we can use calcium hydroxide in the form of non-hardened water suspension, or we can also use chlorhexidine gel 2% or iodide potassium iodine 2%. But I'll say about these medicaments which of them are to be able to use, and therefore this for sure. So the most useful is the calcium hydroxide, because It has really high antimicrobial properties. It's able to destroy bacterial endotoxins and organic tissues. And with respect to endodontics, as I said, is use a water suspension, non-hardened form. With respect to advantages, it has high antimicrobial effect due to high pH, like 12 up to 13. It also it's biocompatible with like root canal system. It could lead to remineralization due to the containing of calcium ions, and also it is able to provide the so-called for creation of self-limited necrosis, so it creates a zone of demarcation, and finally this zone is like bordered from the another part of the tissue, and due to release of calcium ions, calcification is created in some time. And finally, in this place, we can see dentinoid or osteoid tissue. So it leads or it provides the remineralization of some demineralized tissues. But also, because it has high pH, it also has a necrotic effect on periapical tissues. So the same like in the case of irrigant solution, be careful and do not extrude this calcium hydroxide through the apex, because this is a high toxic and could lead to the necrosis of the periapical tissues. Even it has high antimicrobial effect. In some cases, it could have just limited effect on the Enterococcus faecalis and Candida albicans. Candida albicans, this is the next microorganism that could be relatively frequently presented in the root canal and could relatively frequently lead to the failure of the endodontic treatment. And also, according to some studies, repeated application of calcium hydroxide into the root canal could lead to more fragile of dentin. But this is a discutable. Some authors declare it, another one are not agree with them. So we put the calcium hydroxide, like water unhardened suspension of calcium hydroxide, into the root canal for the disinfection, additional disinfection onto the root canal in the case, for example, of some chronic apical periodontitis or exacerbation of chronic apical periodontitis. If we have, for example, immature tooth, in this case, it also supports and provides the remineralization. And also, if we are not able to provide the root canal drying and provide the definitive filling, so in this in the same way, so in this case we put the calcium hydroxide. We can use different methods. One of them, when we mix this calcium hydroxide using the powder and using the distilled water on the glass, and finally we will put it onto the root canal using the special instrument like Lentula one. Be careful because we should use the really slow rotations and carefully gradually remove it from to the root canal. I hope that in fast time we will be able to meet in the clinic and the university, and we will continue with practical part of our endodontic training and endodontics training, and you will learn how we will use Lentula, how we'll put the calcium hydroxide into the root canals. But also we can use the so-called hand method, because sometimes this calcium hydroxide is available in the syringes. In this case we have already mixed suspension, and in this case it's applied using the special syringe or special needle. So we can put it for short and for longer time. In the simple cases, we put it for the 1 up to 2 weeks. In some complicable cases, we can change this remedy. We can put it for the some month. And finally, when we put this disinfection medicament into the root canal, then we should to put the Teflon tape, because this Teflon tape will provide the isolation of root canal from the pulp cavity, and onto this pulp cavity we should to put the temporary filling. During the next visit we will remove temporary filling, and then we will see this Teflon tape, and so it prevents some random unpleasant preparation accidents. Okay, so we put the calcium hydroxide, then we put the Teflon tape, a little amount, and finally we put the temporary filling onto this pulp chamber. As I said, we can also use, or another remedies could be used like intracanal medicaments. This is a chlorhexidine gel and iodide calcium iodine gel. According to manufacturers, to different investigations, they have higher effect on these two mentioned microorganisms in comparison with calcium hydroxide. They are non-aggressive on soft tissues, but remember that, for example, IKI could lead to discoloration of hard dental tissues because it contains the iodine. And for example, chlorhexidine, please note about this reaction with sodium hypochlorite. And so if we put chlorhexidine gel like intracanal medicaments, we should be sure that we removed all of the remnants of sodium hypochlorite. And also this chlorhexidine gel could be toxic to osteoblasts. One more information, that iodide calcium iodine is not available in Europe, but is relatively widely used, for example, in America. So these are the informations about these two intracanal medicaments. Also, when we discard the antibacterial remedies in endodontics, let me say just really short information, some words about antibiotics. They could be used just if in some indications. First of all, this is a different fever state due to different teeth diseases, like for example acute apical periodontitis or acute exacerbation of chronic apical periodontitis in some specific stages, and in just patient if have general alteration. Antibiotics are used in therapeutical doses. Mostly the penicillin is used or is used in the case of remember about the some allergy or hypersensitivity, and please always provide the careful history when you will describe some antibiotics or another substance, or when you use another chemical substance in dentistry. And finally, we need to provide some reconstruction of the crown part of the endodontic of the tooth, where we provided the endodontic treatment or where we provided the application of intracanal medicament. For example, if we provided a definitive filling of root canal system, we should be sure that we will seal these root canal orifices and provide the adequate sealing, and provide the some further application of the bacteria from the oral cavity. And we should be sure that we seal the canal orifices after definitive filling, okay, not after the application of intracanal medicament, but definitive filling. For this same, we can use flow composite, GIC, or some authors also recommend to use a self-cured composite resins. Maybe nowadays the most useful are flow composite, but also it depends on the type of consequent post-endodontic reconstruction. But if we for example plan to provide just composite reconstruction, there is really small loss of hard dental tissues, and composite reconstruction will be enough. In this case, we should to perfect seal the root canal orifices after the definitive filling. For example, as I said, flow composite at least in the layer of some millimeters, to be sure that we provided the adequate sealing. For example, as I said, in some cases we are not able to provide definitive filling in the same visit, and we should to have more visits to finish our endodontic treatment. And before these visits, we should have some temporary crown reconstruction. For this aim, we can use some special temporary cements and, for example, GIC material. The choice of this temporary reconstruction material depends on the amount of hard dental tissues and depends on the size of the defect. For example, special temporary zinc sulfate cements are used if we have just really minimal loss of hard dental tissues, and for example, if we should to close just the excess cavity, for example, in the case of frontal teeth, it's really enough. If we don't have a proximal cavities, it's also could be able to put this material. This is a not so hard and mechanical resistant. It has like a white opaque color or some really slight pink color, because this is a better for our future recognition of this temporary material from the surrounding hard dental tissues. It's non-porous and has good adhesion, but as I said, it's not mechanically resistant and is used just in the case of really small loss of hard dental tissues, mostly if we have just excess cavity on the tooth. If you have some larger destruction of a crown, we should to use some material with better mechanical properties, like for example the most useful in this case the GIC material is. It's non-porous, has good adhesion due to chemical type of the adhesion, and also it's relatively hard and resistant. We can use a special GIC that were developed for the temporary construction. They could be, or they are colored, like they can have some pink color or white opaque color, but also if we don't have this special or automatically colored material, we can put a little amount of some dye, like for example caries detector, to the normal white GIC material, and so we will receive the colored one and put onto this reconstructed like cavity defect. And because it's colored, we during the next visit when we should to remove this temporary filling, we will be able to easily recognize which part of the filling we should to remove, or what we should to remove, and to maximally save the surrounding hard dental tissues. Also, this is just for your information, this is from historic point of view. In other materials are used for them, or were used for the reconstruction, temporary reconstruction. These are the zinc oxide phosphate and zinc oxide eugenol cement. Maybe their main property advantage that they are cheap, but they don't have good adhesion. They're more porous, and for example in the case of zinc oxide eugenol cement, it inhibits the polymerization of composite resin. So due to these some disadvantages, they are not so widely used in endodontics today. And so Like summary of our topics, please remember that disinfection of root canal system is really important. This is the next part of the this is one of the main aims and part of endodontic treatment. Unfortunately, there is still no ideal disinfectant irrigant in endodontics that has all of the requirements. And to improve the effectivity of this irrigation solution, different methods of activation should be used. The most useful solution is a sodium hypochlorite, but unfortunately doesn't have the dissolving effect onto the inorganic part, and so it should be used with some chelator, like for example EDTA or citric acid. So that's all from me with respect to endodontics. So disinfectants, temporary constructions. I hope that we will see you really soon at our university, and we will continue with the practical part of our subject, endodontics. If you will have some questions, ask me. And good luck. Take care for your health, please, and take care for you, and have a nice rest of the day. I hope see you soon. Bye bye.